Welcome back to the Life Unlimited show. I'm your host, Nora Oliver. Today we're diving into a topic that affects millions of people, but often goes undiagnosed, the leaky gut. If you've been struggling with digestive issues, food sensitivities, brain fog, or unexplained fatigue, your gut health could be the missing piece of the puzzle. Joining me is an incredible guest. Meet Anne-Marie Gagné, a board-certified registered nurse and holistic functional medicine practitioner with nearly 20 years of experience in various medical specialties, including transplant, hematology, oncology, and critical care. After overcoming the Lyme disease and an autoimmune condition naturally, she transitioned into holistic care, driven by her desire to provide answers and support to others facing similar challenges. In her spare time, Anne-Marie loves spending quality moments with her husband and 5 children, practicing yoga, gardening, crafting, and caring for her 2 dogs and 14 chickens. Her journey is a testament to her passion for healing and helping others thrive. Today, she's here to share her expertise on the leaky gut, what it is, why it matters, and how you can start healing your gut naturally. Get ready for an eye-opening conversation that could change your health for the better. Welcome, Anne-Marie.
Thank you.
It's so good to have you here.
Nice. Yeah, I'm happy to be here.
So can you introduce yourself and share your background in gut health?
Sure. So I am a board-certified registered nurse. I've been working as a nurse, in, like you said, in various fields for over 20 years. And I turned to holistic care. I think I always dabbled in it a little bit with supplements and things like that, but really took a big turn when I became infected with Lyme disease and struggled with an autoimmune disease and felt that the doctors weren't giving me what I needed. So I turned to myself and healed myself naturally.
That's awesome. So
Yeah.
what led you to focus on the gut health and issues like the leaky gut, which we're talking about today?
So your gut is actually directly connected via your vagus nerve right to your brain. So your gut is responsible for secreting a lot of hormones that are necessary in your body's normal function. So if your gut isn't working the right way, nothing else in your body is going to work the right way.
Absolutely. That makes a lot of sense.
Yeah.
I mean, you have to take care of yourself. So that's crazy. So can we talk a little bit about what is leaky gut? Like what it is and how does it happen?
Sure. So you have, everybody has a normal gut microbiome, which is the normal bacteria that lives in your gut, just like every part of your body has the normal bacteria that eats, and keeps infections away and things like that. So when the normal flora inside of your stomach is off, then your body can't secrete those hormones and work the way that it's supposed to, again, because it's directly related via the vagus nerve. So you have things like your dopamine can be off, which would cause depression, your serotonin would be off, so you would, maybe you're not sleeping so great. And it's those bacteria, that healthy bacteria, that we need to re-inoculate into the stomach.
Wow. I mean, that's a lot of information that I'm not very familiar with.
Yeah.
You mentioned a lot.
Yeah.
But I have dealt personally a little bit on that, right? Especially if you have a lot going on in your life, right? You're not sure what you're eating, what's good for you. Also, where your food is coming from, right?
Exactly.
And we're going to talk a little bit more about that.
Yes.
So can we talk a little bit about what are some common symptoms of a leaky gut?
So symptoms can range from brain fog, like I said, depression, even anxiety. You could have digestive issues, constipation, diarrhea, nausea intermittently, food aversions. A lot of times it will present in a skin like an eczema or rashes and things like that.
Skin?
Itchy skin, yeah,
Oh,
really
wow.
dry skin, little patches of eczema. I know it's dry this time of year, but a lot of times it's gut related.
And it's frustrating though, because from my experience, I've gone to the doctor and I've taken my kids to the doctor, when something just feels off, right?
Yeah.
You go to the doctor, they do all sorts of testing, right? And they say, you're perfect, you're healthy, there's nothing wrong with you.
Yeah.
Yet you don't feel normal, like something, you know, in your gut, right? Your gut tells you, you listen to your gut. We're talking about the gut.
Yeah.
That something is still off. And, you know, the testing they do in a medical setting, it's really, they only detect, you know, very high levels of something is wrong, right?
Correct.
So what happens? I mean,
so I feel a lot of times, and from my own experience and from what I'm hearing from the clients that I'm seeing, is a lot of times they'll go to their primary care physician with a specific issue and get sent to a specialist to work up that issue, but nobody's going to the root cause of the issue, which a lot of times is the gut. Our food is not made the way that it used to be.
Process it differently. So if you're having too much processed foods,
Correct.
you're really, you know, you think, oh, it tastes good, it's cheaper, and, you know, you sometimes are eating out, so it's easier, but what is it really doing to your body? And I know a lot of us, we don't really realize that it's harming us, and sometimes it does take years to really show up, like physical symptoms, right?
Absolutely.
And that's why so many individuals think that it's okay to take that route.
So unfortunately, it usually does present as something, you know, benign, and it's, our bodies produce this immune response because our food isn't food anymore. So when we put things like processed foods like that into our bodies want to attack it. So then our immune system is so busy trying to keep viruses and infections and try to keep us overall healthy that then we put these processed foods into our body and our immune systems are just tired. They're overworked and they just can't process it anymore.
Exactly, and again, I'm sharing a lot of personal stories, but I'll tell you like a quick story.
Sure.
I allowed my kids to eat school lunch once a week, and then there was a point for a few months I allowed them to eat, I think it was a Wednesday and a Friday instead of just a Friday. And normally we pick a Friday because it is easier for all of us and they want to fit in with the school, but that 2 days a week damaged my son's gut pretty heavily. To a point where he was diagnosed with arthritis. It was that simple, and they wanted to do all sorts of, you know, take this drug, let's do this injection, and it was scary, and I was against it. Like, I can't put my son into that because some of the side effects of that medication was to lose he would lose his hair, and that was cancer patient's medication, giving it to my son for arthritis, right? So here we are. I went to a person like you, and we took the natural way of healing his body. I stopped allowing him from eating school lunch. And that alone, guess what happened? Nobody's going to believe this. The doctors don't believe it now. They know we didn't do the treatment. All they know is we changed the way he eats. We stopped eating at school. That one day, elimination of the food made a huge difference. So yes, many people don't believe that removing the processed foods can make a huge difference, but I am here to actually share a real story that this happened.
I'm so happy for you.
I know.
I'm so happy that you were able to find something that didn't damage all those things. And I think that that's what people are looking for. They're looking for something that isn't another specialist and isn't just another pill. And, you know, this isn't a trend. This is real life, and our bodies just can't keep up anymore.
It's truly real. I mean, the amount of doctors we saw, all kinds of specialists, all kinds of urgent care doctors. And nobody could tell us what was wrong besides they assumed it was an autoimmune disorder.
But did they ask what his diet was like?
No, nobody ever talked about what we eat, what we drink, where we go, how he lives.
How much he exercises, how much water, sunlight, all those things. And that's the foundation of health.
Exactly. That's the other thing, too, I want to talk about is that nobody talks about the quality of the water. Nobody talks about what % of body water is your body made out of.
So much water.
Especially children.
Nobody
actually, there's probably other people out there, but they don't talk about the fact that children are made out of water. I think it's is it 75%? Something like that on that range. But adults, it goes down a little bit, right? Because of muscle weight and all that. and bone density, but nobody talks about what actually matters, and that's the frustration part of it. And a lot of people, I hear, you know, I don't want to say excuses, but I cannot afford the healthy foods, and it's too expensive, and that sort of thing. But also, I'm not sure if you're aware, but there's actually programs. There is federal programs that you can actually have your doctor, your primary care, write your prescription for vegetables and fruit.
I did not know
There's
that.
actually a federal program. You can go online and look it up. You can ask your doctor to write your prescription, so you get free. You can go to a food market and get your free vegetables and fruits.
Right. And I do think that, you know, I understand that aspect of it with, you know, not being able to afford organic, and there's not even a lot of variety in a lot of the local grocery stores for organic foods. But I think taking the time to really be mindful of like washing the pesticides off, because that, you know, when you do put those things inside of your body, the first thing your body does is recognize it as an attack. So instead of fueling your body with the food, you're producing that immune response. So your body is already fighting it. And so instead of absorbing those nutrients that are supposed to go into the cells, it's attacking them. So now you're all behind the 8 ball when, you know, if you took that little bit of time to soak your veggies or your produce in, you know, some apple cider vinegar, you can get the little ionizer. There's a million ways to do it. But to do it, to make sure that you do it, it's really so important.
I'm so glad you said that, because I have sent, so often my family hates me for this, but every time I wash my vegetables, I use, I don't use vinegar. I used to, but now I just do the baking soda and water. But if you look at the water after I've cleaned the vegetables, and I have a routine where I highly recommend that others do the same, that as soon as you bring your vegetables and fruit into the house, just clean them, wash them, don't throw them into your fridge, because when it comes to eating them, you're in a rush. You're like rinsing them for a second, and I mean, what are you really doing? You're just getting them wet. Nothing's falling off it. So take your time. This is the most important part of your life, is eating the right foods and having clean food, right? Just like clean water we just talked about. So the amount of little crawly things in the water after I clean the vegetables and fruit is disgusting. It almost makes me not want to eat the food that I buy. And I buy organic, non-GMO, right? But still, like, it doesn't matter where the food is coming from. It still has to go through a process. It still has to go in trucks and different containers, and, you know, stuff gets in it, so you've got to wash it.
Especially with kids. Kids will just, you know, open the refrigerator and just take it, and they don't think twice about it. You know, so having it in the refrigerator already cleaned and processed is so much better. You know, and I do find that if I do that, my kids eat a lot more fruits and veggies too. I feel better too. I know everything on my fridge is organized, it's clean, healthy, you know. Go for it. Absolutely.
So what kind of health issues can be linked to leaky gut?
A variety of health issues, autoimmune, like you mentioned with your son, and that can range from lupus to rheumatoid arthritis. There's multi-autoimmune diseases.
Like you said, skin conditions.
Skin conditions.
Brain fog.
Brain fog. All the, I mean, it's systemic. Depression, anxiety. And then that can be confused with other things. You know, if you have these other symptoms, and, you know, they can be confused with, you know, or they, you know, scratch that, but they send you off to a specialist, you know, for eczema when it's really...
It's your gut.
It's your gut.
I know. It's frustration. It's very frustrating because my daughter, all my kids had eczema growing up, right? It starts from when they're first born. The moment they're introduced into this new world, right? We immediately put all kinds of skincare products. A baby does not need lotion.
No.
Here we are putting lotion. A baby does not need all this shampoo. I mean, where did it come? How did it get dirty? It wasn't outside running around. I mean, some of these things we're not thinking about, right? We're making formula. Where's that water coming from, right? We're introducing all sorts of things into their body. So there's a lot we don't think about, but also it's something we're not taught, right? So it's very hard to be out there, you know, we're not sure we're making the right choices. Everybody, I'm sure, is doing their best. But, you know, there is a lot.
There's a lot to learn
that you can get support from, you know. We have the internet. There's a lot of support groups just on Facebook itself, right? Go on there and type in, you know, leaky gut, for example. I'm sure there's lots of groups in there that specialize in it.
Yeah.
And then talk to your doctor about it too, or find someone like you, right?
Right, yes. Come
so how can someone tell if they might have a leaky gut? Are there any tests, or like how do they go about it?
So, I mean, there are several tests that we can do. We can check the pH of your stomach, see if you're sitting on like an acidic side versus, you know, a more alkaline side. That's not really indicative of leaky gut. It's usually symptom-based. It's usually you're symptomatic. You have, you know, undiagnosed or untreated autoimmune conditions or skin conditions. It's usually the things like that that are first signs. And then you think that you're dealing with something, you have this new chronic illness. No, you don't. You have a leaky gut.
So you're talking about tests like a GI map study or
yeah, so we
else?
can do that. For me in my practice, it's all self-pay. So I don't like to necessarily send, because then it's more medical than it is holistic. And there are ways. There are ways to diagnose it without having to do anything invasive.
Wow. Okay.
Yeah.
Well, that's good. I've had all that done in the past, which is why I'm bringing it up, because I've seen, you know, years ago, I've seen, you know, like onions, for example, would irritate, inflame my body.
Yeah.
And I wasn't allergic to it, but it just was irritating my gut because my gut was already unhappy.
Right.
So sometimes there's foods, right, that you have to kind of stop eating for a little while until your gut has a chance to heal, and then you reintroduce those foods slowly.
You know, like your seed oils, your processed foods, things like that. Those are the things that you want to avoid if, you know, you think you have a leaky gut. Spicy foods, things like that.
Oh, right. Yeah. The spicy food. So what are the biggest causes of leaky gut?
Is our food.
So it's purely what goes
in
your gut.
Stress has a big factor to it as well. But yeah, what we're putting into our bodies.
I mean, it's right there.
And that's what's maddening, is because you'll go to the doctor with an issue, and you know, and then you get sent to a specialist to work up the issue, and they say there's no problem, and there's not, because the issue isn't because you have an issue. The issue is because you have a leaky gut.
Wow, it's so frustrating though, because nobody teaches you. You go to those annual checkups, right? Wouldn't that be the perfect time to go over? What's your diet like? How do you feel after you eat? You know, what's your lifestyle like, right?
Right. And that's really what did it for me. Was, like I said, I was struggling with my own autoimmune disease, and you know, I've gone through endocrinology, rheumatology, gastroenterology, infectious disease, all the things, and everyone works up everything, and then there's nothing wrong with me, but my body's still not working. So there's something wrong. Right.
You just know.
You do, and it was then that I said, you know what, I'm gonna figure this out, and I'm gonna fix it on my own, and I did. I came off my immunosuppressants, and you know, I do a lot of tinctures and vitamins and things like that, but it's all the things that we're not getting. Normally we would get these things in our diet because we lived off the earth. Right? But we're not anymore. We're eating constantly processed foods. And so we're not getting those vital trace minerals and things like that our bodies need to process.
I absolutely agree with you on that.
Yeah.
From a lot of life experience, my kids and myself, so it makes a lot of sense. So let's talk about how does processed food and sugar contribute to gut damage?
Yes. So sugar is, we all know sugar isn't the best thing. If you are going to have it, you should have regular, real sugar.
Like real sugar.
Right. Not any of the processed or, artificial sweeteners, because those wreak havoc on your immune system. But sugar itself feeds things like yeast. And when you have yeast overgrowth in your stomach, you crave sweets a lot more, and then that contributes to brain fog even more so, and lack of sleep, and again all those hormones that gut-brain axis, everything is just thrown off.
Yeah.
But yeast especially, that's usually where we see a lot of yeast overgrowth in the stomach. You see a lot of sugar cravings, and then it becomes systemic, and then women might see, you know, an increase in yeast infections or some yellowing of their nails, and that's where you're seeing yeast, or maybe a little white film on your tongue, because it's all connected.
Right. Yeah. So it's
systemic.
That's true.
Yeah.
That's true.
Yep.
Yeah. Wow.
And that's not anybody, you know, if you go to the primary and you say, you know, I think I have a gut issue, they're not going to ask you if you've had a yeast infection, right? Because why? But that is so indicative of whether you've got yeast overgrowth.
Right. And I don't even know if the doctors can do such testing.
I don't think they ask the questions.
I've never been asked, and I've had issues with my gut.
Yes.
I've gone through all these very unnecessary endoscopies.
Yes.
It's not easy because you're putting your body in so much trauma.
Yeah.
I mean, you're introducing something that shouldn't be into your stomach.
And then you're exposed to, you know, they send you for tests and all the things, and you know, it's very invasive. They take your blood. It's painful. You know, there are risks involved in that. They send you for tests. You're exposed to radiation unnecessarily. There's so many things that can be done first, that should be done first, rather than going for those invasive things. Sometimes it's very simple. You know, we have to go back to basics sometimes, you know, and that's the difference between, you know, what I do at, you know, from my home office, you know, where it's holistic care. We look at the whole person, as opposed to going to the doctor and they look at you based on your body system. Your primary care is supposed to be your overall care. Well, if you have an issue with your gut, they're going to send you to a gastroenterologist,
specialist,
you know,
in that.
and then it just snowballs from there.
But even that, I've been to a GI doctor, and they have their own nutritionists there.
Yeah.
And I've met with them.
Yeah.
And it's frustrating. Maybe, you know, I'm not saying they're all similar, but the fact that they don't talk about organic, the healthy foods, right? They tell you, eat vegetables, eat fruit, right?
And they all do.
Not the quality.
They all eat organic.
What matters is the quality of the food, right?
Right.
Not so much the quantity.
Right.
Right? So that's where we kind of go wrong a little bit.
Yeah.
Let's talk about maybe the stress part. Do you think stress and lack of sleep could really harm or make leaky gut more worse?
So yes, but I think that it's the leaky gut that causes those things.
Oh, the other way around.
It's the other way around. So like I mentioned earlier, your stomach is directly connected via your vagus nerve to your brain. And that area of your body, your gut, believe it or not, is responsible for secreting your serotonin, which is your happy chemical. So people who have a leaky gut tend to have a little bit of depression or anxiety. It's also in control of secreting your dopamine, your happy chemical, right? That instant, you know, gratification, that happy feeling. Yep. On top of that, it also secretes your melatonin.
Oh, right.
Which
helps you fall asleep.
Which is your circadian rhythm. That's your normal sleep cycle. So if your gut is off, you're going to have all these other things off. Your ability to manage stress is not going to be what it was, because you don't have the appropriate dopamine and serotonin levels.
Yeah.
And it just continues. Same with your hormones, you know, and that's why it's so all related. You're a whole person.
I know, and I'm looking at it, you know, by you just explaining that. If you just, I like to say, zoom out and really look at how your body functions.
Yes.
If you don't eat food, what happens to you, right? So if you give it the right foods, what happens to you? If you give it the bad foods, what happens to you, right? Talk to all the kinds of people out there and see that what you put in your body is what fuels you.
Yes.
You are what you eat, right?
Absolutely.
Exactly.
Absolutely.
Are antibiotics and certain medications a risk factor of a leaky gut?
Absolutely. Absolutely. So like I mentioned earlier, you have that gut microbiome, all those good bacteria in your body. So when you take things like antibiotics, it completely wipes out all that good bacteria. So a lot of times with leaky gut, we'll reset the whole gut, where we'll say, okay, you don't have that good bacteria, so let's re-inoculate it with the good stuff, and that's where, like your fermented foods and yogurts and things like that come into play, because we want to take out, you have zero good bacteria, so there's nothing there fighting, what should be, and producing those hormone secretions. And so we want to re-inoculate the stomach with all the good bacteria.
That makes sense.
Yeah.
What are the first steps of healing a leaky gut?
Yeah, so like I said, I had mentioned resetting the gut, taking away all the foods that contribute, the processed foods. Alcohol is a big one. Sugar, sweets, things like that. And then introducing things that have the good bacteria. Apple cider vinegar with the mother in it is really good. Things like kombucha, where it has the fermentation, and this is why sourdough bread is so popular right now, because it's fermented. It is that good bacteria that we want to put back into the body.
I'm so glad took me years to get my kids to eat, to go from white bread to sourdough.
Yeah.
And now that's all we eat.
Yes.
So again, it's hard to remove all the foods you're currently eating now, because it's such a shock to your body, and also forming those healthy habits, right? Many people can actually, start small, right? You probably do that at your practice, so that they start getting better.
So it's attainable. So it's not overwhelming, and it's something that they can do on a consistent basis, because I think that that's what is most important. You have to be able to do whatever it is that's going to make you better consistently. Right. So if you make it as simple as possible, then you'll have a better outcome.
Exactly. Are there any specific supplements that can help, like probiotics or collagen or anything else? So
yeah, pre and probiotics are great. Depending on, which, I use a couple of different companies that have different protocols for gut reset. I personally, I like tinctures. A lot of times with supplements and vitamins, your body, especially if you have a leaky gut, you put that pill into your body, and now your leaky gut that's not working has to process that pill and break down before you even get any of that vitamin. So the company that I use is it has a lot of tinctures.
It has a dropper?
A dropper, so that when you take your supplements, they go right into your bloodstream. Your body doesn't have to break it down, so that way it's working right away.
You know what, I believe in that too, because that's what I've done for my kids and I. There's all sorts of probiotics out there. You can go to grocery stores. There's non-refrigerated.
Yes.
And refrigerated.
Right.
So a lot of people don't actually know the difference, right? What I've noticed, and what they can, others can tell too, is that the refrigerated ones are probably 3-4 times the dollar amount.
Yes.
But
those
the
are the
probiotics
ones.
have to be alive, right? And if they're dry, I don't know what you're eating, powder?
Right. Yeah, I mean, exactly. And that's what I tell my, if you don't go through the company that I use, then that's exactly where I tell them to go. Go to, like your Whole Foods or, Wegmans, and go to the refrigerated section and get yourself some real live.
Do your study, right?
Yes, probiotics
do the
and
company
prebiotics.
Research, like where is it coming from? How long is it sitting in the refrigerator, right? Because if it's sitting there for a long time, even if it's refrigerated, it goes, those cells die after so long, right?
Right.
But yeah, yogurt, like you mentioned, that's great. That's a great way, because there's so much that you can get
culture.
out of it.
Yeah.
How long, I know this is a big question, but how long does it typically take to heal a leaky gut?
So I say 2 months.
That's it?
I think if you're regularly working,
really heavily
working on it. Yes, I say within 2 months, you should feel immensely better.
Wow, I need to come to you then.
Yes, yes.
Wow.
But yeah, so I like to see my clients after 1 month, and usually by 1 month, my bloating is gone. I feel better. I've noticed a difference in my skin. Usually in a month, and I say 2 months. Give it 2 months, because if you feel this good now, you're going to feel
Imagine
amazing
in 2 or 3 months.
2 months. And a lot of
Yes.
times
Yep.
they will continue it because they want to keep feeling good,
Right.
you know, or if you, you know, have a course of antibiotics for something else, then, you know, absolutely, you know, then you restart it and make sure that you maintain that good bacteria.
It's worth every single dollar
Yes.
to feel better. Now, leaky gut is a big deal.
Yes.
I mean, that completely
Systemic.
transforms your life.
Yes.
When you feel better, you can concentrate. That means you're
Yes.
a better parent. You can study
Yes.
easier, right?
The brain
Memorize
fog is
more. You can work better. I mean, I can see how it helps you in so many ways. Your gut
Absolutely.
is everything.
It really is your second brain.
Yes, it is
Yeah.
actually. I used to think it's the first,
Yeah.
really, because
Yes.
this feeds that,
That's right.
right?
Yes.
So what lifestyle changes can people make to maintain long-term gut health?
So again, like incorporating things that have cultures like the kombucha or apple cider vinegar with the mother, yogurt, things like that. Staying away from your processed foods, seed oils, you know, using things like olive oil, avocado oil.
I love avocado
You know,
oil.
and staying away from like the sunflower oil and the peanut oils and canola and vegetable. Those aren't good for you. And, you know, adding the pre and probiotics
Right.
and, you know, just really eating a clean diet. But there has to be balance at the same time. So, you know, you have to, because there's a lot of things you can't avoid too. So you do have to find that balance. But the more that you eat clean, the better you're going to feel.
Right, especially for individuals that eat out a lot.
Yes.
That's extremely difficult because I don't really know too many restaurants or fast food places that have healthy foods. They may, you know, right now there are so many terms that they call it natural.
Yes.
Natural does not mean healthy.
Correct.
So there's all these new words are being used
Yeah.
on labels to make it look like this is the best for you, but it's just another word for, I don't know, sugar or processed
Absolutely.
food or,
I mean,
you
look
know.
how they changed the dyes, the names
Right.
to be, you know, creative, so that when you saw them, it was something fun, you know. And I think that it's unfortunate that that's what we're doing to people, you know. I mean, we
It's
have no.
very sad.
It is really sad.
Yeah, and
you know.
the healthy food is so expensive now. If you find it,
Right.
in places you find it, because I walk in, even Wegmans or Whole Foods, you walk in and you see a majority of the products, it's not really food.
Yeah.
It's just packaged in this box, or, you know, they store it and it's not what your body needs.
Correct.
And yet we're paying to make
So much
ourselves
money.
sick.
Right.
Just think about it. You're throwing your money away to make yourself sick,
Yeah.
which then you have to pay to go to a doctor, which then you have to pay to fix your gut.
Right.
When if you just take care of it from the beginning,
Right.
you won't need
Or
all
if our
that,
doctors
you know.
educated people. You know, I mean, if there was education, and that's sort of what I do in my practice is, you know, it's great that I have the knowledge, but I'm not going to follow you around all day.
Right.
So when I see a client, I'm teaching them. I want them to know so that they can do it for themselves, because it's confusing. You
It
hear, you know, 5 or 10 different things, and you hear this on TikTok, and you see that, and then you Google it, and there's so many things that you don't know. And that's where I think, you know, having that medical background and doing the holistic functional medicine
Right,
is
you see both sides.
see both sides of it.
That helps a
Yeah.
lot.
Yeah.
Yeah. So if someone feels overwhelmed about their gut health, what's the one thing they should start doing today?
I'd say probiotics.
That's a great
Probiotics
point.
is, I mean, because at least today you can start introducing that good bacteria. If you don't know anything else, I would say that would probably be the
And
first thing that you could do on your own with, you know, without, to help re-inoculate
No,
your
it's
stomach.
good feedback. At least they get started on that,
Right.
and they may feel a difference, right? It may
Right.
take a little bit longer without the other
All the other
things
stuff, yes.
that need to be
Yep.
Removed, but it's a good
And
start.
again, like I said, it's you know, making it feasible so that it can be consistent. Because without consistency, it's
That's true.
right. Your body
Right.
then is just confused. What am I doing? Am I attacking what I'm eating, or am I not? And then it you know, it becomes
And then you end up at this point where you are so healthy. You're eating healthy all the time.
Yeah.
And it doesn't mean you don't eat processed foods.
Right.
You probably have a day here and there. You're allowed to go have a meal somewhere with
Yes.
friends. It's not so healthy, but overall, the big picture, you're eating healthy all the time.
Correct.
But then you end up, every time you eat out, you feel that difference.
Yes.
Like, oh, yuck.
Yes.
My body didn't like that food.
Yes.
And that, my friends, means you're doing a great job.
Right.
You've trained your body to identify what's good and what's bad for you, but also you feel it.
Yes.
I've been doing all the great things.
Yes.
I'm not going to do this so often.
And usually it only takes 1 or 2 times of having a bad meal after feeling good
Right.
that you decide that you don't want to feel like that again.
Right.
And,
Like
and you're
alcohol.
less likely to go
Yeah.
out and do that again because you do feel so good.
Right, and there's many people out there that don't want to drink, but if they're single, they want to go out for a drink or, and immediately people assume if you don't drink, you were an alcoholic, right?
Correct. Correct.
And people don't understand that others are trying to be healthy,
Right.
right? And that's where they're like pushed into drinking alcohol, and again, they pay
Yes.
for it later. So
And that again,
you
just
just
like-
have to
Yeah.
stand up for yourself and what your body needs, right?
Right. And I'm sorry to interrupt, but that is another one of those things that completely wipes the microbiome. If you think about what alcohol is and how we use it, it wipes everything out.
I know, it's a
So-
social drink that really destroys
It's
your
poison.
gut over time, especially.
Not saying I don't
know,
enjoy one, but it is poison.
It is.
Yeah.
It actually is.
Yes.
I mean, there's nothing good in it that's going to help you.
Yes.
So, Anne-Marie,
Yes.
where can someone find you and your services?
So you can find me on my website. It's www.agwellness.org. I see clients out of my home office in Billerica. So
That's
you
nice.
can find me on Facebook, either by my name or my wellness page. I live by my phone, so I make my own appointments and all that. I don't have a secretary yet. And and we can talk about what the needs are, what's going on, and really get to the root of the issues.
Yeah, I mean, that's great. Start with the consultation, and
yes.
that's where you really find out what's been going on and how you can help. So, I mean,
Yes.
that's great.
Yes, and I do my initial consultations I book for 2 hours. And the reason I book them for 2 hours is because a lot of people have been sent from one doctor to another and nobody has heard them. And so we sit and we talk, and I want to hear everything. I want to hear all of it because there's usually something deep rooted and pull that out and get that out. So you're not rushed from, and left with no answers. So
That
I think
makes
it's
sense.
really important to hear people. People want to be heard.
And I'm sure they have a long history of everything
Yes.
that's happened, and
and
there's-
being pushed off to other,
Right.
from one doctor to another. And so, yeah, we take the time to hear what's going on and see you as a whole person.
That's awesome. Well, Anne-Marie,
Yes.
I love all the feedback you shared, and I think
Thank
this
you.
is going to help so many individuals.
I hope so.
I'm so thankful that I'm sitting next to you and we're talking about this topic, because this is such a big topic
Absolutely.
that I think many individuals need to really take it seriously.
Yeah.
So thank you so much for being
Thank
here.
you. Thank you for having me. I
Thank you.
appreciate it.